Welcome to the Outsmart Burnout podcast. I'm your host, Dr. Zaria Rubin, a functional medicine doctor, an international speaker, and a burnout badass because I've been there myself. After walking away from my own high-stress medical career, I discovered how to break free from burnout to reclaim my passion, purpose, and joy. And now I'm here to help you do the same. From science-backed tips to time-saving hacks, and hopefully some aha moments that just might change your life. So sit back, relax, and let's do this. Welcome back to Outsmart Burnout, the podcast where we explore some of the most complex, deeply personal topics with honesty, heart, and practical insights. Today's guest is Dr. Erica Bove, a double board-certified OBGYN and reproductive endocrinologist and infertility specialist who has spent her career helping women navigate the emotional and clinical complexities of infertility. She's also the founder of Love and Science, a highly specialized coaching program designed to support women physicians and professionals on their infertility journey. Dr. Bove blends evidence-based reproductive medicine with mindset, emotional support, and community, offering a compassionate approach to infertility that acknowledges how deeply identity, expectations, stress, and relational burnout can intersect with a desire to build a family. In this episode, we will dig into the emotional heart of the infertility journey, confronting burnout, self-doubt, identity shifts, and how women can reclaim their confidence and resilience when the path to parenthood feels unpredictable or even at times impossible. So happy to welcome you to the podcast, Dr.
Thank
Erica.
you.
Hi.
Thanks, Dr. Zaria. Yay. I'm so happy to be here.
Yeah. So, there's so much we could talk about and dive into, but I'd love to take a step back and just explore a little bit about your story and your journey and how you came to this work and what made you choose
Yeah.
this medicine to help.
Yeah. I think it chose me. I tried many ways to resist a career in medicine. I wanted to go to Europe and, study Romance languages. And I will say I got into medical school in air quotes, like by accident. I was kind of hoping it wouldn't happen. And I studied for the MCAT. I did all those things, right? But I think I've always just had a ton of interest, just like you. And one of them being languages, and one of them really being like what motivates people, what motivates human beings to make their choices, to live their best lives, to grow, to evolve, to handle the hard questions as we were just talking about. And so once I figured that out, I was like, okay, I know I happened to get into medical school, but I think I'm going to be a psychiatrist and cure the world of eating disorders. That was my interest at the time. So I went to medical school, loved it, met amazing people, studied women's health. But then when I got to my clinical rotation, I was so engaged during women's health rotations, especially OBGYN and family medicine. I love like the GYN. On the schedule, I always look for the GYN visits. And psychiatry, even though I appreciated it, it was not my pace. I mean, you can tell I talk fast, I walk fast, I like to use my hands. I like to solve, actionable problems. And I was just exhausted. I was like, why do I need this lunch break? Time was moving very slowly. And, in life, sometimes we expect one thing and then we decide to pivot. Everything in my body was telling me that psychiatry, even though I have a huge respect and appreciation for it, that was not what I was supposed to do. And so, as we do our introspections, I was like,
Well, ironically, you are kind of doing it a little bit, right?
which is the funny thing how life comes full circle. So, but my late grandfather was an OBGYN and he actually died before I was born. He was the first, and I was the first grandchild not delivered by him actually. And I've always felt his spirit with me, always. And so I think we have to welcome these influences. He is with me in the OR. He's with me in my dreams. It's really profound, his influence on my life. And so I decided to go into OBGYN because it felt right, and my father was like, "Are you sure?" And I was like, I just have to go with it. And obviously being fully supportive. And then once I got to residency, I kind of had a hunch I was really interested in the fertility side of things because it's just the work is so meaningful. It's, you walk with people through their hardest times. you celebrate the wins, the joys, the hugs, the, announcements, the, baby showers, the birthday, like you really grow with people. And I just really felt called really to walk with people during this time of their life. And, not just to like get to the end and celebrate the happy news, but to really spend weeks, months, and sometimes even years with people during these very difficult stretches.
What a great story. And it is such important work. And I feel like, I don't know if it's just the media or if it's just our culture and society, but I feel like we hear about so much infertility these days. Like it's
Yeah,
almost rare for me to talk to somebody and they say, I didn't have any problems.
totally.
It's
Totally.
like, oh yeah, I needed help. I needed to do this. We did IVF. We did this. Yeah, I froze my eggs. It's like, it's everybody is struggling in
Yeah.
some way on this path. And what do you think is contributing to this sort of infertility epidemic that we're
Yeah, I
seeing?
think it's multifactorial. I think, with women being in the workforce, I think that back in the day when women used to get married at 18, 20, and just start having children, I think deferred childbearing is definitely part of the equation as women are trying to balance having a career, having their families, and when to do those things. I think there's also a lot of environmental influences. I think that we have a lot of stress. I think we generally lead unhealthy lives in terms of diet and lack of exercise. Men's sperm counts worldwide are actually declining, which I find fascinating and a little scary, to be quite honest.
Yeah.
I think our lives are very unhealthy. And I do wonder, I think that there needs to be more education for women, especially as people are trying to navigate a career. I think there needs to be more access, right? It's like the people who can afford it who are able to access the treatment, but the studies show that most people, maybe even 90% plus who could benefit from the treatment aren't able to access it for various reasons. And to your point about the media, I have this love-hate relationship with the media because the media almost treats it like a commodity. Like you get your REI, you have your designer baby, and then it just works and you move on. Nobody talks about the need for donor egg IVF, especially with later reproductive years. Nobody talks about, people are starting now, but I don't think that what's shown to us through the media is the reality. And I'd really love to find a way to bridge those two, to tell more real stories of real people with real journeys and not just like celebrities who choose what they want to share. Which again, everyone's entitled to share what
Amen.
they want to share, but
But
we have to
it
remember
creates
it's
sort of an
curated.
unrealistic,
Yeah.
like, it creates an unrealistic picture
Yeah.
or maybe unrealistic
Exactly.
expectations or can create a lot of self-doubt or shame or
Yes.
failure
Yes.
thinking like, "Oh, I
Yes.
don't why does my life not look like that?"
Exactly. That's exactly it. And sometimes people have
Yeah.
multiple things going at the same time, and because they can do it's just we just don't have the full picture. So if you're listening to this right now and you are either overtly or covertly judging yourself against these celebrities, just know that you are not alone. It is at least 1 in 6 couples that deals with infertility. It is often not a straight journey. And I say the 11th commandment should be thou shalt not compare. Like, do not compare yourself to anybody else's story,
Girl,
right? I know, right? Because we have
compare and
no idea what their
despair.
story is. Yeah, compare and despair. We do not compare, and it will just save so
So
much suffering.
hard.
It's so hard
Yeah.
not to do it, but we just can't because we don't know their story.
So, yeah, I love that. It's such an important point to make. You mentioned just a minute ago about the environmental factors. And
Mm,
aside from environmental factors like literally our water and air and the chemicals that we introduce into our bodies, which we can get to, all the endocrine disruptors, stress. Obviously on this podcast, we talk a lot about stress and burnout. Talk to us a little bit about how that might negatively
mhm.
impact the fertility journey for people.
Absolutely. I cannot believe with 40 plus years of IVF that we have not made more progress in the stress research with infertility. When I was in training, I asked about it, and my mentors were like, oh, yeah, stress is really hard to measure. We don't really know. I mean, we all know there's an impact, but we don't want to blame anybody. And so, I have been on
Wow.
this mission, right, to like help people navigate this journey. This splits up marriages. People, go into deep depressions. I mean, people drop out of treatment because it is just too emotionally hard to keep going. People run out of funds. I mean, there's just so many aspects. There's evidence, there is data about this actually, that people with an infertility diagnosis they have at their new patient appointment, they have comparable anxiety and depression rates to patients with cancer. And those scores get worse with time. So with every failed embryo transfer, those anxiety and depression rates get worse. And so we have this huge epidemic of truly mental health issues. And yes, it is stress, but it is like actual mental health. Like, we talk about, like I've heard you speak about truly clinically diagnosable problems with brain chemistry. And then what do we do about it? And so I was maybe 2 years into being an attending. I've been out about a decade now. And I started to realize I just was not connecting with my patients. And, just like you, like go to work, do your best, try to, be empathetic and kind and curious and all those things, share the data. And I recognized that the patients who were in front of me were in this like hypervigilant state so that nothing that I would say would sink in. And I know because I've been there myself, right? I know that when I'm heightened, when I feel threatened, a lot of the stuff just washes over me. And I thought, well, this is not productive. Like, here I am. They took time out of their day to have this appointment. I'm trying my very best to help them understand their diagnosis, their treatment options, all these things. And we have this massive disconnect. And so once I started, engaging in coaching, I've drank the coaching Kool-Aid since about 2018, right? And I started to just say, what if I just tried out some coaching tools with my patients to see if it might help their nervous system to help them navigate this process? Because, it hurts in so many ways. I truly think it hurts on a physiological level. We know that when we're stressed out, that our adrenal glands kick on and that releases more cortisol. It releases a lot of the stress hormones like epinephrine, norepinephrine, because, deep down we think we're being chased by a bear, right? That's like physiologically we think we're being chased by a bear. That's okay when we're being chased by a bear, but that's not okay chronically, right? That's not okay because infertility, like I said, is a journey
Yeah.
that's like weeks and months and years. And so what we need to do is figure that piece out because it's not good for our bodies to be releasing so much cortisol, right? Cortisol, it makes it harder to maintain and lose weight, as I know you talk about. And so that keeps us, not just maintaining weight, but even gaining weight over time. So people talk about these massive weight gains during these treatments. I think stress and the high cortisol definitely play a role. People talk about not sleeping well. We know that sleep is really important for egg health and just quality of life in general, right? As it can happen with perimenopause. So we have many hits as well. And, I think that also there's this emotional component where we have a harder time making empowered choices. And so if we are faced with decisions, but we're in a fear based state, we're not going to be able to make the best decision for ourselves. And we might even decide this is too much. I can't do this anymore. Maybe the universe is telling me that I'm just not supposed to be a parent. And so we see hugely high numbers of mistakes in treatment. We see hugely high numbers of true dropout from clinical care because people just their bodies, their nervous systems, their relationships, they can't take it. And I thought, this is not right. And I will tell you, I don't have a ton of data. I have some data to share with you that if you look at the hair cortisol levels, if you look at the salivary, the saliva has this enzyme called amylase in it. If you look at those, there is evidence that that influences fertility and that there's also some emerging evidence that mind body programs can make a difference. I have evidence from my own practice that
Wow.
people who have been told that they have no chance are getting pregnant and staying pregnant. And I know of other coaches who run successful mind body programs who are seeing the same thing. And we need to catch up with our research, but I will tell you stress matters. It affects everything related to physiology, ovaries, uterus,
Right.
receptivity,
Yeah, I
all of
mean,
it.
we know you can miss your period. Like, if you can miss a cycle due to
Yeah.
stress, and if
Yeah.
you're not ovulating due to
Yeah.
stress,
Right.
obviously on a pretty basic level, that's gonna
Right.
impact your fertility as well, right?
Yeah. And
So
it feels
is
so bad. Yeah. It feels
yeah.
bad. It also feels bad.
Oh,
So it's
yeah,
really important.
and then it's sort of a vicious cycle because you're stressed that you're not getting pregnant, and then you're stressed, and that
Yes.
might negatively impact your ability to
Yes.
conceive.
Yes. Yes. I actually have a podcast called Stressed About Stress. That's
Yeah.
one of my episodes. Yeah. Yeah.
Okay, I love that because I talk about that a lot, and I, used to be stressed about stress, like, just in general, knowing what I know as the functional medicine doctor and just
Mm,
how bad stress is for you in terms of overall health, inflammation, like, as a doctor, you know too many things, and so I knew every time I was stressed out, that I'm actually damaging,
yeah.
my immune system, my nervous
Totally.
system, my
Totally.
cellular levels. And I was just like, I can't be so stressed out. But then, we can't be stressed about stress either. We
It's
have to
true.
kind of
Yeah.
empower ourselves. And I think that what you just mentioned about this mind body connection or about these coaching programs, which we're going to get to because you have one, right?
Yes, I do.
Um, that can really make a difference. So tell us a little bit about how Love and Science was born.
Yeah. Well, I think I started to share the origin studies. It really was born out of my feeling inept at helping my patients in the office. After all these years of training and studying to be good at what I did, I felt like I truly wasn't reaching my patients and they were suffering, right? They were alone, they were isolated, they weren't able to make decisions. I call it analysis paralysis, right? And so I decided to just start, especially at these decision points. Like, there comes a point when somebody's like, okay, you've done 3 IVF cycles. And again, don't quote me hard numbers, but I'm just giving an example of a typical scenario where they say somebody's done 3 cycles with their own eggs and it's not looking promising to keep going on that trajectory. And people really want to be a parent. That question of, do I think about donor eggs? Do I keep going with my own? Do I back off from IVF? Those are really, really, really important points in the journey, right? And I think, yes, we can explain, where we are and what the data show, but to help somebody make that really important decision, and maybe even a couple where they might be on different pages with the situation, I think it's really, really, really hard. And so that really begs the question, right? Those deep questions like, who am I? Who am I at my core? Why am I on this path? What does motherhood mean to me? Is it related to the DNA? Is it not? What about this field called epigenetics, which is that the environment can influence the expression of the DNA? And so, to really help people, first of all, calm their nervous systems to be in a safe space, right? That's the first step. To understand their deepest motivations, coming back to the motivation piece, their deepest why, and then to be able to articulate, right, to understand the science, to understand how to use their voice to ask better questions, to get clarity, to be able to navigate this process. All of that is what the coaching does. And so we have a course that helps walk people through these tools. We have one-on-one coaching sessions which allow for, personal transformations. And my favorite part is actually the group coaching because these women, they gain so much from each other. They heal in community, and the isolation that many people say is the absolute worst part about this process, it just melts away because people now have a community. And it's amazing. Like, even a couple of months ago, I had a client with over 20 years of infertility. She was like, Erica, I have not had a positive pregnancy test in over 20 years. And we worked, and again, multifactorial, right? Mindset. We had to work on mindset. We had to help her get some good embryos, right? We had to do that. She needed a surgery on her uterus. So I helped her, make that decision. And she went on a GLP because she had gained all this weight during the process. And so she took 3 months off to heal from her surgery to go on the GLP. She came back with this renewed sense of self, her, really understanding her deepest why. She was getting triggered, but we worked through that. She went into her transfer calm. The transfer worked. And she's now well into her first trimester. She's graduated from her REI and she's on her way and it's going to work. I mean, it's
My
just going to work.
God.
And so these are the
Wow.
stories that are so beautiful and powerful. And I don't think that that person would be where she is without this deep work, without this deep is healing and working through the trauma. Again, most of my people are perimenopause as well. So we have that layer as well. But really, figuring out for each person what their pathway is going to be and then helping them to bridge them really to parenthood in a way that this journey doesn't steal everything, but it also gives them tools that they can then apply to parenthood, work, relationships, any other aspect of life as a more evolved human.
Yeah, I think that it's amazing. That's an amazing story and so hopeful for people out there. And I think that, yeah, that there tends to be so much focus on the technical and the medical and the physiologic aspects of infertility. Like, you're having all these tests, you're getting all these
Yeah.
injections, you're monitoring this and measuring that. And the mental, emotional aspect tends to get disregarded or ignored.
And trauma. Trauma. I wanted to bring that in because I know that you're an expert in trauma. Like, we store trauma in our pelvises, our pelvic floor. We store it there. It is real.
Wow.
There is a correlation with people with endometriosis in a history of trauma. We have to release that energetic block. in order for people to be able to receive their embryos. It's just the way it has to be. And so I always ask, it's very hard to talk about, right? It's really hard to go there to talk about different traumas that people have, little t traumas, big T traumas. But until we address the trauma, this process doesn't work. It just doesn't.
Well, exactly. And that goes back to what we first talked about. If you have undiagnosed trauma, if you have either, PTSD, complex PTSD, you are going to be living in that heightened sympathetic state. So
Exactly.
your baseline is going to be higher levels of cortisol and
Yep.
norepinephrine and adrenaline. And
Right.
so you're already kind of at a disadvantage. You're
Totally.
starting way far behind the starting line. And
100%.
if there's a way to address that and mitigate that and sort of break those cycles and change those stories and narratives, then
Exactly.
wow. So, like I said, yeah, you are kind of being a psychiatrist at the
Yeah,
same
it's
time as
interesting.
being an infertility doctor.
It's interesting, yeah, and I mean, if some people truly need, like, brain chemistry meds, and obviously we all partner together, but I just wanted to share that about the trauma because I think that in Western medicine, there's just not time to address the complexity of these problems, right? There's not time. But I think that's the beauty of being able to have a coaching practice that where people have the time that they need and deserve. And people, I mean, over 50% of my current clients have gone on. There's a women in labor right now, actually, a Love and Science baby. It's just like, and that's the fun part is people kind of send me their baby pictures and I think it's important to share these stories because some people truly think that there's no hope for them. And the infertility journey in and of itself creates burnout. People get tired. Sometimes they live several hours away from their clinics. They're going every other day. They're getting hotels. They're draining their funds. I mean, it's like infertility is like a part-time job at least, if not a full-time job. Finding
I mean,
time to
yeah,
pick
it
up the phone,
could be like a full time job.
so if somebody already didn't start burned out, as many of my people already start this process burnt out, they're probably going to get there without some serious help to navigate the process. I always say to my clients, I'm like, what energy do you want to show up at the fertility clinic with? Like, is it calm? Is it peace? Is it acceptance? Is it love? Fear, anxiety, they're allowed to exist. They're allowed to coexist, but they're not running the show. And I think for so many people, those are the dominant emotions, the fear, the despair, the hopelessness. And when that happens, our vibration is truly more it's lower. It's a lower frequency vibration. And we don't attract those good things in. So again, this is not to say like, oh, if it's not working for you, your vibration just isn't high enough. That's not to say that at all, but it's to say that there are actually tools that work to help release trauma, to help create what I call authentic hope. Authentic hope is hope grounded in science. We have to create our scaffold on the science of the things that are actually good and working and not all the things that haven't worked thus far. And so that there's a very specific way of doing it, but it works and it's amazing. And I think it is really at this intersection of burnout and stress and trauma and what I call authentic hope.
Okay.
Yeah.
I love that phrase, authentic hope. I feel like we all need that right now in the world.
Oh, I
So
feel that.
talk to us a bit more about what that means and what that looks like and how you help your clients
Yeah,
arrive at that authentic hope.
absolutely. I think it's really hard to do it ourselves. I think that, I have the benefit of all these years I mean, I've been in medicine 20 plus years, right? And so I can see the patterns of the things that are truly good prognostic factors for my people. And so somebody might see me and the story that they may give is like, I've tried everything. I've done 7 IVF cycles. I've had 4 embryos transferred. They were all high quality embryos. There's something really wrong with me. I'm broken. Like there's no chance that this is going to work. And so, I hear them and I validate like that's a long journey, like very stressful, very depleting, and at the same time, let's also look at what's in your favor. Maybe you're only 32 years old with excellent egg reserve. That's something that we can hang our hat on that like we are very likely to get more good embryos and perhaps we just haven't figured out exactly where the disconnect is. So that would be like a factor for authentic hope, young age, good egg reserve. Even if you're 40 years old and you have excellent egg reserve, it's a lot easier to get a good egg out of a lot of eggs than it is to get a good egg out of few eggs. That's just the way it works statistically. And so I say, hey, you're 40. We can't change age, but guess what? Your anti-Mullerian hormone is 5. That's fantastic. Like, we can work with that. Maybe it's something that somebody's been pregnant before. I think people get very, very concerned when they've never seen a positive pregnancy test. There are still things we can do about that too. But I say, hey, listen, either you've been pregnant before or you've had a kid before. That's a good thing. And so I'm always scanning, not in a Pollyanna way at all, not in a silver lining way, but in a truly scientific way of saying, why does it make sense for you in front of me to keep going? I'm seeing somebody later today who has a very long journey, but in her story, I see so many reasons why this happened. You had this complex surgery and people haven't sorted that out yet. Oh, that's really interesting. I think you need more imaging. You haven't been evaluated for endometriosis. That's still something that we can do. And so I think people get very stressed when they think that they're out of options and out of like what they're like, I've only gotten bad news. The bad news is only going to continue. But when we can zoom out and take the big view, kind of like we're on an airplane, like looking down and say, that's actually really good in your favor. That's also really good in your favor. That's also really good in your favor. Let's keep going because we know that people who stick with it in a very thoughtful way are ultimately likely to succeed. But like we talked about before, it's so hard to do that. So that's how I see authentic hope as like somebody, like myself or somebody like me who has the experience to say, you know, our negativity bias prevents us from seeing the things that are actually in our favor. But there's usually a mix of both. So how can we attune our brain to scaffold on those good things, those positive factors, and that gives us sort of fuel for the journey.
I absolutely love that. And, there's this one phrase that people always used. My journey was different because it was sort of a strange infertility journey that I just couldn't meet my
Right,
husband,
right, right.
find a partner till I was in my 40s. And people would always say to me, you have to stop trying. And it'll happen when you stop looking and when you stop trying. And I basically wanted to strangle those people. Because while I understood where they were coming from and the advice was well intentioned, it was like, I don't have time to stop looking and stop trying. And in fact, I didn't stop looking and stop trying. I constantly was, putting myself out there and it was exhausting and I was burned out. But I think I can imagine it being very similar
Yeah.
along this journey of like, you just have to let it go and it will come to you, etc. But like that advice can
Mm.
often fall really flat. And do your people come to you with that and that notion of like, I have to somehow stop trying so hard to make this happen, while at the same time knowing
Yeah.
that need for control
Mm.
and stress aspect of it isn't helpful. And how do you balance that?
So that is the $1,000,000 question. So I would say most people come to me thinking that they just need to work a little harder, that they need to control a little harder. Most of my people are like type A perfectionists who the equation has been work harder, get what you wanted. Like that's the equation professionally. And I say we need to throw that out the window. And so obviously these things have to happen in a safe container. Obviously we have to establish trust. But that's why I have people work with me for a minimum of 3 months because these things take time. So I see it. There's like a formula. And again, everybody's particular way to get there is a little different because everyone has a unique story. But what we do is we remind people that they are already whole human beings and that there are so many aspects of their life that are going really well. And even as hard as it is, we sort of envision, we go to the worst case scenario. We say, it is possible that this journey could end up without a child. And can we go there in our minds and understand that we're still going to be whole human beings? We're still going to have a meaningful life. And what could that look like? And people are often resistant to doing this at first, but I say it's really, really important because what gets us in trouble is the overattachment to the outcome. And we have to go to worst case scenario, which is either like in your situation, remaining alone, or in my client situation, not having a child. And when we can then face that fear, then we can back up and say, okay, how can I hope for this with everything that I have? Authentic hope, of course, and then release the outcome. And I see
Mm.
it. I see it on my calls. I see it. I see when the energy starts to shift. I see when people are truly letting go. And it's so interesting. Like I had a client the other day say to me, Erica, like I thought this was all about control. She's newly pregnant. I thought this was all about control. But the less control I try to have, the more grounded and in control I feel because I realize I'm actually not in control. And it's like this paradox of like, so what I really help
Yeah.
people with is surrender, which nobody comes to me as like, Erica, can you please just help me surrender a little bit more? Because that's not. But when we can get people say, what is the secret sauce? What is the equation? How can I finally get this to work? And I say, you have to let it all go. You have to like make your empowered choices, but you have to release your attachment to the outcome and we'll work on it. We'll get there together. And when people can actually do that, whether it's through IVF, whether it's out of IVF, outside of IVF, that's when it happens. And it's wild. And I will say, there are some people, like I have a client right now, and it is clear that her own body is not going to allow this to happen. And she's now pursuing a gestational carrier. So there are situations where no matter how much we do, that there is a pathway, even to be at peace in that situation, to say, like, you know what, like I did my best. This is clearly the way that it's going to happen for us if we're going to have a kid with our own DNA. That's its own sense of peace. And so it's that surrender, which I think is really hard for us as humans. I mean, I daily surrender because there's so many things in my life I just want to control. But the magic happens when we can actually let that go.
I think that is so powerful. And you absolutely nailed it when you said that, the certain type of person who maybe works with you and who works with me or type of person that I am, we're so used to getting what we wanted out of life by working harder, by striving, by achieving. That formula, that equation, it sort of worked out. It's like if I just push harder and study harder and, get really good grades and just keep going, keep trying to be the best and work the hardest, then all of these things will happen. And, it's not perfect, but that striving and that overachieving really kind of got us pretty far on a certain path, but it's not going to find you a partner and it's
Nope.
not going to, help you have a child. And those were the things that were so important to me and they felt so out of reach. And because I couldn't strive for them, I couldn't try harder. It wasn't about trying harder. That didn't work. And that's such a hard sort of pill to swallow.
It is. It's the unlearning that we need to do. And I say, like, we can do it. But what happens is when we do that, the feelings come up. I mean, and that's also what I help people with, because I
Yeah.
think that when we're in control, and I put that in air quotes because we never really are, but when we feel in control, there's like this powerful thing that happens. And sometimes there's no space for feelings. But when we allow ourselves to take a step back and not to be, even just to let go of the illusion of control, it's much more vulnerable and some feelings can creep in. That's when the sadness can creep in, the grief, there's trauma. I mean, there's all this stuff that comes up. And so a lot of what I help people with is processing the feelings in that uncomfortable space. So many of us are not taught how to feel our feelings, but we can metabolize our feelings. They actually have something to teach us. But that has to be part of this work too, because we can't just disarm ourselves of being in the driver's seat and then be like, okay, all is well now. It's like cleaning a room. I mean, we start taking stuff out of drawers and it's like, oh, this is a mess in here. But
It has to get worse before
it
it
gets
can get
worse
better.
before it
And
gets better, but that's why they need, you and me, like, or people like us who can be the guide to be like, you're still safe. This is part of your evolution. And as we are able to hold space for those uncomfortable emotions, that's really, again, when the magic starts to happen too.
I think that's so powerful because if I really am honest with myself, a lot of the striving and the achievement and the, dedication to that path was so that I could avoid feeling all of those really
Totally.
difficult feelings and negative emotions. And the more I ran from that, the harder I worked, the more I achieved,
Yeah.
the less
Right.
I had to, accept and address all of that underlying trauma and sadness.
And the wheel
And
of burnout is we
it
think that
eventually
if
comes
we just
back.
keep going. I know. Yeah,
Yeah.
we think that that's the pathway and it's not. And I think it's hard because we're rewarded externally for certain things, right? Like whether it's
Yeah.
a promotion or a publication or whatever it is, even
It's
our
the
own families
prestige
can.
of
Yeah, yeah,
achievement. It's
yeah.
like,
So
oh,
it's
well, so
yeah.
fancy.
It is a tough pill to swallow because it's like, and your family's not gonna think as highly of you, and you're gonna be really uncomfortable sometimes, but you're not gonna be alone, and you're gonna be evolving, and ultimately this is gonna work for you. And so I think people can get on board when they're like, okay, there's a process, this is a safe space. But, it really is it's like the harder journey, I think, because we do have to allow for that discomfort, and how do we do that if we've never done that? If that's not been our coping mechanism, we gotta do it, but we do it in community, we do it with a guide, and, I think you and I have both realized in our own lives that our life is richer when we can allow for those things, but
Yeah.
it's a daily turning over, I think, of our will and our ultimately, we got our freedom, but we have to let it go.
Ugh, I love this conversation.
Yeah.
So we always try to leave folks with some practical tools or advice, and I would love it if you could like maybe give us either an exercise or a mantra or just something that helps,
Mm,
maybe a daily ritual that helps you personally stay grounded, or one that helps your clients release some of that
yeah.
stranglehold control. I don't know if you have anything
Yeah.
for us today.
Gosh, I mean, it's so, I think about self-care. I think self-care is very personal. One thing that helps me is I do have a meditation practice. I meditate for about 10 to 15 minutes every morning. And, like, I just do it as my coffee is going and I sit down and, like, for some reason when I do that, it grounds my day. I can find my breath better. I can watch the things go by, watch the situations happen in real time and not necessarily get as involved in them. And so a lot of my clients have also found that having, like, a regular yoga and meditation practice brings them from this cerebral spinning, dropping them into their bodies. And, the body, we have so much internal wisdom in our bodies and we don't listen to it, but when we do, so many beautiful things can happen. So for me personally, a daily meditation practice and going to yoga as much as I can, that really grounds me and calms my nervous system. There are several mantras that we have at Love and Science, and I think one is especially important for somebody who's, like, newly pregnant, and so I think, that's the goal, right? Is that there's ultimately a pregnancy, but in my experience, it's like, when's the other shoe gonna drop? Like, when am I gonna be diagnosed with it? Maybe they've had a miscarriage before. Okay, well, I haven't gotten to 10 weeks, and 10 weeks is when it happened. Like, there's all these different milestones that can happen, and so one mantra that I love is, like, "So far, so good." So far, so good. Like, it is so simple. But if we can say, huh, the embryo implanted, huh, my first tests were normal with a rising, beta HCG level, huh, I had a heartbeat at my first ultrasound. So far, so good. So we're not going to get too far ahead of ourselves, but we're going to stay in the moment. I do the
Mm.
same thing for my clients and my patients too, who are awaiting all the data with in vitro. It's almost too much information, right? There's like how many eggs did I get and how many fertilized and what's the embryo. And so I'm a runner. And so I say, we're just going to pretend we're in a race, right? We're gonna say, okay, we're gonna pass the mile marker today. Mile marker number one is eggs. Right? We break it up into small parts. That's all you gotta focus on is just getting eggs today. And we'll get you through that. We'll wake you up, there's gonna be eggs, and then we'll allow ourselves to focus on the next milestone, which is fertilization. Okay, great. That's tomorrow. We can do the next 24 hours. We can wait that. And so I find that people are like, what if, what if, what if, what if, what if? And that then gets them hyper vigilant again, but a lot of what I do is bring people back to the present moment, bring people back to the actual reality, bring people back to the authentic hope and feel any feelings that come up. And I think that's a really powerful thing. And then obviously, like, there's personalized mantras that help different people. Like, I'm doing my best is one that people really do love to hear because I think there's so much shame in this and so much like self judgment. And so we try to release all of that and bring in some self compassion. I mean, I could go on forever, but I think that the most important thing I tell people with infertility is this is not your fault. This is absolutely not your fault. And there are ways through. This is just because it hasn't worked thus far does not mean it's never going to work. And you need your A team, and like try not to blame yourself because there's nothing that you did that caused this. And I think when people can really internalize that, it allows for so many other things to move forward.
Ugh, I think, wow, you just shared so many important truths with us. And I think the one that stands out for me is sort of the past doesn't necessarily dictate the future. And I think we can often get really hung up on that of like what hasn't worked so far, so it's never going to work. And it's more like, well, it hasn't worked yet.
Correct. Every cycle is a new opportunity. It's we're building on data from the previous cycles and so there's always more options, right? And so there's different protocols and you take the data from the past and you look at it and you integrate it at the same time do the mind body work. And I mean, that's why I think this is working for my people because it's love and science. And I've had it suggested love as science. I really do resonate with you as well, I can tell. But it's like we are so devoid of love. We're so disconnected. And I think when we can connect with each other, when we can truly even connect with ourselves, we're so disconnected from ourselves, and we can start to make that connection to our highest, wisest self internally, then we can start to make those empowered choices. Then we can start to feel safe. Then we can move forward. But there's so many fragmented pieces of the way we live our lives, right? We need to transform that in order to move forward on this journey. So, yes, the past, the trauma, all the negative, bad news, all those things, like it doesn't mean it's not going to happen again. And that's why we lean on the authentic hope to move forward in a way that, we're always getting stronger, we're always evolving. And as I see people evolve and allow the science to work for them very thoughtfully, that's when I see people have their successful outcomes, and we celebrate. We don't just go through all the bad stuff and all the drudgery, but it is a really beautiful thing. Every single thing we celebrate when it's going well, and I think there is authentic hope, and I think people need to hear that message.
I love it. And I think everyone listening to this episode is probably going to want to know where they can find you, how they can learn more about love and science, how they can maybe sign up for the program and get your
Absolutely.
magic touch.
Yes. Okay. So the most comprehensive place is my website. It's loveandsciencefertility.com, right?
And we'll put all this
Everything
in
on
the show
socials.
notes. Yeah.
Yeah, yeah. Thank you so much. And then social media, Instagram, Love and Science Fertility, Facebook, same thing. And then I'm also on LinkedIn. And so I have a podcast as well. It's called Love and Science Fertility. Listen to that. I really there's sciencey episodes. There's more emotional based episodes. I really put a lot into that. And I'm just about to launch a course as well that has sort of the top 12 tools that I found most helpful for my people. So I get on the waiting list for that as well. Yeah.
Well, thank you so much, Dr. Erica Bove, for being on our show and sharing so much of this deep personal work and authentic hope that you've just given all of us. I think it's really kind of invaluable. If you listened to this episode and you loved it and you know someone who could benefit from this, and I bet we all know someone who has been on a fertility journey, please share this episode. Leave us a comment, a like, a review. It really does help the show get seen by more women. And that's our goal, is just to really help more women discover the information they need so they can get that clarity, that courage, and that compassion on the fertility journey, on the burnout journey, on all of these journeys. And that's why we're here. So remember, at the end of the day, burnout is not your destiny. It's your wake up call. Yay!